Hi, this is Dr. Andrew Turchin from Aspen, Colorado, and today I'd like to discuss my patient's most common aesthetic concerns. One of our patient's most common aesthetic concerns is broken veneers. This is an emergency that we see at least a few times a week here in Aspen, Colorado from patients all over the country. And this is such a common problem in dentistry that we've spent a couple of decades developing different processes to make sure that our veneers do not break. I saw this very early in my career, and I was positive that I was going to solve this problem, and we have. Right now we have a 99.6% no breakage rate. So first and foremost, it's the way our veneers are made. There's a very, very strong material out there called Emax or lithium disilicate that most people are using for porcelain veneers, and some are still using a very traditional porcelain, but Emax is 3 times stronger. The problem is, even people using the 3 times stronger material are cutting off, the laboratories are cutting off the edge of the tooth and building that in traditional porcelain, because that's where all that translucency and effects happen in a tooth, or at least a lot of it, and they do that so they could get the right effects. And after many, many years of trying every technique in the book, I feel like Thomas Edison with this, my laboratory and I have developed a process where we have the Emax, the stronger material, all the way to that thin edge that is the most likely to break. And we do that without cutting back the edge, and it's literally micro-layered on the front surface of the tooth so that the edge is at full strength with the stronger Emax material or lithium disilicate. Another technique we use is the way we bond them on. The stronger we bond them to the tooth, the stronger the material becomes, because in our practice, our veneers could be as thin as a fingernail. 0.3, 0.5, maybe 0.7 millimeters thick. So they're ultra, ultra thin, which even with a strong material are relatively fragile, but the strength comes from how they're attached to the tooth. And our bonding process is, I call belt and suspenders, because we use 2 different techniques to make sure our veneers don't come off. Very much like, obviously, belts and suspenders, we don't want our pants coming off. But it is probably just as embarrassing in life to have a tooth come off than have your pants fall off. So I call it the belts and suspenders bonding technique. And lastly, occlusion. Occlusion is the way your teeth come together, how your jaw motion moves. It's relatively complex because it's the muscles, it's the teeth, and it's the joints and how they all interact together. But it's imperative, even more so than with natural teeth, that the occlusion and the way your teeth come together works perfectly when you're dealing with porcelain veneers. So we dial in every patient's occlusion to be the ideal occlusion so that the forces are controlled on those veneers. So those are the 3 techniques we use to make sure that we have that 99.6% no breakage rate, and it's something that really just doesn't happen in our practice now.